Hi everyone. Today we'll discuss about mammography. So it is the screening procedure used for breast cancer. It is nothing but the X-ray of the breast tissue. It uses low voltage and high amperage system. So radiation exposure of 0.1 gray per study. There are two views, craniocaudal view and mediolateral oblique view, which covers the greater volume of the breast tissue including upper outer quadrant and axillary tail of Spence. And when this screening procedure is done every year for the patients who are above 40 years, and this radiation exposure will not increase the risk of breast cancer. So features of malignancy are solid mass with or without stellate features, asymmetrical thickening of the breast tissue and clustered microcalcification. Screening mammography reduces breast cancer mortality by 20 to 25%. So annual screening starts from the age of 40 years, and it is not done in young patients because it's a dense breast and there are many false positives. So BIRATS scoring, it's breast imaging reporting and data system. So this is very important. It starts from 0 to 6. So 0 is assessment is incomplete, you need to go for further imaging and evaluation. 1 is negative, so it is a normal study. So routine screening of every year is required. Benign finding, so the malignancy risk is 0% and every year screening is sufficient. And 3 is probably benign, so the risk is just 0 to 2%. So it requires short term follow up, usually every 6 months. From 4th is suspicious abnormality. It is divided into 4A, 4B and 4C. So the 4A is low suspicion of malignancy of 2 to 10%, and when the report comes as BIRATS 4, these patients require biopsy for further evaluation. And 4B is intermediate suspicions, so 10 to 50% of chances of malignancy. And 4C is of high suspicion of malignancy, which has 50 to 95% risk, and biopsy is required. And 5th, BIRATS score 5 is highly suggestive of malignancy, which has a risk of more than 95% of to be malignant. So it requires biopsy or surgical management. 6 is biopsy proven malignancy. So this is the normal view of the breast. This is the mediolateral oblique view, and this is the craniocaudal view. In the mediolateral oblique view, you can see the upper outer quadrant with axillary tail of Spence. And this is the normal mammogram. So the next it comes to the abnormal findings, that is the features of malignancy. You can see the stellate shaped mass in the mammogram with few calcifications, that is known as the clustered or the pleomorphic calcification. And here you can see the distorted structure of the breast. So coming to the questions, so all are indicators of malignancy in a mammography except, so in this, so the nodular calcification, speckled margin, attenuated architecture and irregular mass. So nodular calcifications, malignancy will be usually microcalcification and not nodular, so the answer is option A. Popcorn calcification in mammography is seen in, it's a straight question, fibroadenoma. So the next question is, 55-year-old post-menopausal woman on hormone replacement therapy presents with heaviness in both the breast. So the screening mammography will reveal a speculated mass with cluster of pleomorphic microcalcification and ipsilateral large axillary lymph nodes. With all these features, the most likely diagnosis is carcinoma of the breast. Next is, with reference to the mammography, which one of the following statement is correct? It's a baseline study should be done for all women at the age of 30. So it is not done in younger females because of dense breast. So this statement is false. It uses less radiation than a chest X-ray. No, it is almost equal. So it should be the part of the regular follow-up of a woman following therapy for unilateral breast cancer. Yes. So once the patient undergoes MRM, so to follow the patient of the other breast to detect the secondaries or second primaries in the other breast, we use mammography. So that is a true statement. It provides an efficient substitute for biopsy of suspicious lesion. No, always biopsy will give the confirmatory diagnosis of malignancy. So this is a false statement. So the correct statement is option C. The next question is the routine screening mammography. It starts from 40 years and BIRADS 4 suggests there is suspicious of malignancy. BIRADS score 5 is highly suggestive of malignancy, and risk of malignancy in BIRADS 2 is 0 to 2%, and the radiation dose in mammography, as we have already know, it is 0.1 centigrade per study. And which of the following is seen in carcinoma breast? You see mainly pleomorphic calcification. Thank you.